Hey guys, I'm Natalie. It's nice to see you all here. We're either very brave or very stupid. We will find out in a couple weeks. So a little bit about me. I am a compliance analyst at Mercari. They're an e-commerce app. People buy things, people sell things. I write rules to make sure that they're not selling counterfeits or drugs. And at least recently, I am making sure that they're not selling face masks and hand sanitizer for astronomical prices. That's what I've been working on for a couple days. I took a nonlinear path to get here into tech and data, but the important thing you need to know about me is that I got my master's in public policy a few years ago because I was really into public policy, especially healthcare, but all sorts. And so I found the transition between public policy and data to be pretty seamless because good policy needs to rely on data. And a lot of people who are also in policy, they understand that. But when I was trying to network and talk to people in tech, talk to people, private companies doing data, they weren't quite sure how I made that jump. So that's what I'm here to tell you about. So real quick, what is public policy? I'm not going to give you a definition or anything, but I like this metaphor. Think of public policy as the frame of a house. You need the frame to build anything on top of it. You need the frame to be there if you want to build a house. But if all goes according to plan, you never think about that frame. The frame's just there. Real quick, I want to apologize. I know you're here to spend 2 hours not thinking about infectious diseases, but we're going to talk about the measles outbreak last year. So the measles outbreak 2019, it was over 12,000 cases nationwide. 75% of it was in New York City and the suburbs. And most of it was in 4 specific Brooklyn neighborhoods. They were primarily ultra-Orthodox and Hasidic Jews. So this was the largest measles outbreak in 30 years in New York City. They spent over $6 million. They had 654 people infected, 52 people hospitalized, and out of that, 73% were unvaccinated. So you're in the city government. You work in New York, you're in the city government, and what do? You need to make a policy. And how do you make that? You need to answer a question. So the question you come up with is solutions-based. You say, what can government do to increase the MMR vaccine intake? That is pretty straightforward. This is what you want to get done. You want people to get the vaccine. So you say, all right, how do we do that? It's nice, it's solutions-driven, but we can't actually solve this problem without the data. So I'm going to back up a little just for a second. I want to talk about policymakers and politicians. A lot of people tend to conflate the two. They think policy and politics are very similar. They are not. So back to my metaphor, policymakers are the people who are building that frame of the house. They care about the structure. They want it all very sound. And politicians, they're more the people who are trying to sell you that house. It would be great if the house was going to stay up, but that's not really what they care about. So back to New York, the politicians, they needed to sell a house, and they needed to sell it really fast because this was an outbreak similar to what we're dealing with right now. They needed a reaction, and they panicked. So what did they do? They made the measles vaccine mandatory for 4 zip codes in Brooklyn. So what's wrong with this? This was a problem. This was policy without actually looking into the data. So what's wrong with this approach? It's bad optics. Like I said, the 4 zip codes were primarily a religious minority. And no matter what you feel about how to solve the measles vaccine, this does not look good. Secondly, it's kind of biased. So the headline says, parents of 3 New York City children face $1,000 penalty for violating the measles order. But we can rephrase that. Parents of 3 New York City children pay $1,000 to opt out of the measles vaccine. So once again, the policy was mandatory, but only for people who could afford not to do it. And finally, it's counterproductive, because nothing rallies the opposition more than forcing your will upon people. So what do? We need a different question. So instead of thinking about what the government can do to just make everyone get that vaccine, we say, well, why are vaccine opt-out rates increasing? So the nice thing about this is that it looks at the heart of the matter. We're looking at the causes, not just the solution. And so we're using the data to drive that solution. The problem is, it's kind of challenging. So the logic model, if you're in the back, you might not be able to see it. A logic model is what policymakers look at. They're looking at how people's attitudes get affected by external stimulation, whether it's the media or their neighbor, and then how that results in their actions. So in the first column, we have people who believe the vaccines are harmful, believe the vaccines are good. Modifying factors in the second column, that's the media, that's your neighbors, that's education, and then likelihood of action. It is whether you talk to your neighbor and they say, oh no, my child has the measles, or you talk to your neighbor and they say, yeah, we're not going to get vaccinated. And that all depends, that all predicts what happens. And this is good, but there's no data behind it. It is good to show how every factor relates to these actions, but we need some numbers. So what does the data say? So I found a meta-analysis online, and it's looking at what factors are associated with vaccinations. It found a bunch. None of these are super surprising. We've got not believing vaccines to be harmful, having a general positive attitude towards the vaccines, trust in the healthcare profession, and others. And so we use these findings to increase outreach in these communities. And so this is actually what happened later in Brooklyn, in those communities. Educational literature, we had healthcare professionals writing pamphlets and distributing them that were sort of talking about the myths about the dangers of vaccination and passing them out. And then community outreach, we had nurses actually having meetings with mothers and their kids to talk about science, to talk about vaccines, and really connecting with people. And you know, data is really good for policy, but there are some challenges, so we should talk about those. The first is it's incomplete or biased data. So let's say you're in charge of designing national policy. It could be about vaccines, it could be about anything. And then the data you get is data from affluent suburbs of New York City and LA. You get data, but that's your only data. And so the policy you make, it's not going to be representative. It's not going to be good for the whole country. And so, you know, we can use data, but it needs to be complete. The second challenge is the stakeholders. With policy, because it affects so many people, it has a lot of stakeholders. People are going to lose, people are going to win from whatever policy you make. And this can be different levels of government. This can be state budget versus city budget, or even what Portland wants versus what Beaverton or Gresham wants. These are all very separate competing interests. And then the American public is always your largest stakeholder, but they're not a monolith. Some people want higher taxes so they can have more public services. Some people want less taxes and they don't care about the public services. And third is corporations, which are often in opposition to what the American public wants. It depends, but a quick example would be when the government made airbags in cars absolutely mandatory for all cars sold in the States. And this was good policy. It benefited the American public, but it cost a lot of money for these corporations. So all of these stakeholders have different needs. And measuring outcomes is always a challenge with policy, as it is for much data in the real world. So randomized controlled trials are, of course, the gold standard. But we've got a few problems with that. It's complexity. Randomized controlled trials really are trying to focus on a specific thing. They're controlling for all other parts besides what they're measuring, and that is sometimes not possible with real-world situations. The budget, sometimes you just can't afford to have an old program and a new program and compare them together. And then ethics. So let's say we only did outreach in 2 out of those 4 Brooklyn neighborhoods. And then those 2 Brooklyn neighborhoods, their vaccine rate increased. That's not a good idea. So instead we have correlations. Correlations, I mean, it's good, and the nice thing about correlations is that they are stronger when you have more data points, and with policy, because it affects so many people, you often have a lot of data to compare. But the problem, of course, is that correlations don't tell you everything. In Rockland County, that would be the suburb of New York that had part of the measles outbreak. They were very happy. They could show on paper that when they forced people who were not vaccinated out of all public spaces, they said, look, our rates of vaccination went up. But what they didn't know, what they didn't see, or what they weren't paying attention to, is that those rates of vaccination had been going up since the measles outbreak began. And when they made that order to keep people out of public spaces, the rates actually went down from that. So instead, another outcome, or another way we can measure, is with KPIs, key performance indicators, and we can do that really nicely with the policy initiatives. So you have your question initially, and then that's what you measure. So we can look at vaccination rates. Now, we're talking about New York, we're going to go to California real quick. So in 2016, California eliminated the personal belief exemption for the measles vaccine. So this was similar to the religious exemption, but it was just for anyone. And then they had 3 years of data to see how that policy fared. And so they looked at vaccination rates. They said, okay, well, we got rid of this exemption. Did vaccination rates go up? Yes, they did. That's cool, but that was our first initiative, and we didn't like that initiative so much. So what about the opt-out rates? So it got rid of personal belief exemptions, and the opt-out rates, also went up. So was the California policy successful? It depends. All right, so I just want to go real quick to just talk about how data science can help build strong policy, because it can help in multiple ways. So we start just by understanding the problem. We see, is there a problem at all? And what's the scope of that problem? When we consider solutions, we can look at small solutions, we can compare them to each other, and then we can measure the outcomes, as I was just saying, anything with data. And finally, we can use data science to drive community support, because we always talk about telling stories with our data. And stories, that's what people hear. That's what people are going to listen to. And that's it. So my slides are on GitHub. I'm always on Slack, so poke me with any questions.